Hello, everyone, and welcome to this Bostix broadcast, part of the a Bostix bulletin and part of the a newscast edition. This is a chartered edition with a Bostix broadcast as part of an evidence-based perspective and a Bostix broadcast as part of the Communique Tsunami. This is another Storm Robotics production. In this Bostix broadcast, there'll be a sort of an overview in around looking at can social media reduce discrimination and ignorance towards patients with long-term conditions, and using a CKD, a chronic kidney disease example in the United Kingdom, and where this works sort of retrospectively was collaborative works between colleagues around two where there was where collaborators were from an academic institution in Malta, and where colleagues was where another colleague, the collaborator from the health informatics and data, and data accessibility, a sort of one voice coalition for accessible information communication technology in the United Kingdom, and where collaborators were between two social media platforms, two social media organizations and platforms, and also and also an NHS trust in the United Kingdom, where this works was originally peer reviewed and published in a journal in 2016. This work was presented as well, presented at the International Pediatric Nephrology Association, IPNA in 2016, as well. So here, as part of this Bostix broadcast, I thought here'd be an opportunity, or a good sort of an opportunity to highlight this works as an overview. Um, in around sort of this in around this works, long-term conditions or LTCs are increasing in prevalence, have been increasing in prevalence, and in context of cost in Western healthcare. Patients with such conditions are often classed as disabled because of impacts on self-care, or on in around activities around daily life, or secondary consequences, secondary consequences of conditions or impairments affecting factors such as for example, mobility, concentration, in around communications. Disability needs are often ignored in the design of services, and treatment of individuals, and it manifests as services which some find difficult or challenging to use, and a lack of where in around this, there's a basis of a lack of sort of respect in context of where this context falls under sort of discrimination, often based on lack of understanding by for example by for example in around health the healthcare profession itself, for example, and in around aspects of society, of different aspects of society, and where this then falls in the bracket or under falls into the bracket in around ignorance. So the works, this collaborative works, looked at sort of looks at how social media in around an example of assistive technology, in and where social media and assistive technology, in some bases have been increasingly utilized in context of the digital age, and how these sort of bases might help in regard and relating to sort of aspects of discrimination, in around discrimination and ignorance. And the focus, at the same time, in around this works, was around chronic kidney disease, looking at CKD, chronic kidney disease, from a not from a condition or a health condition, and where we're two highlighting sort of specific bases in around sort of UK United Kingdom or UK, sort of a UK sort of example or perspective, and also where this works looks to highlight that support mechanisms now emerging may well go beyond aspects of healthcare, and even beyond aspects of kidney care practice, and they may and where generally in context of population, in context of population, the collaborators had highlighted had highlighted in this works that 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 sort of more sort of more evidences have been sort of have been documented by, for example, the English Accessible Information Standard, and the works this works the main objectives, the main specific objectives, was where using a CKD, example, aligned to long-term conditions. This works explains, puts experiences and consequences in context of discrimination and ignorance, and above all, the works, the collaborators also sought to highlight what has already been sort of evidence, in context of healthcare, and how prospectively there could be there could be and should be a more sort of a more integrative basis around works from the perspectives around discrimination and ignorance. This works again also highlighted that that the that sorry this works also highlighted that that in the in also sorry also highlighted that a central concern to both national and international governments is trying to better understand how to effectively support patients with disabilities and long-term conditions like CKD, who have increasing can have increasing complexities, complete increasingly complexities, and where this and this has, and where this has been driven by shifts in context of public policy. An example of perhaps an indirect yet authoritative discrimination against people with disabilities, for example, specifically was in a recording that had been made during a fringe meeting at a government at a particular parliamentary conference that took place in 2014, and the Minister for Welfare Reform back then, or retrospectively, had highlighted, and this is a sort of a direct quotation, that some disabled people could be paid £2 an hour rather than a full rate of £6.50, wherein the minimum wage apparently sort of retrospectively in 2014 was in around £6.50 if they wanted to work, and this was published in a tabloid paper in 2014 as well. And the minister of welfare reform the statement highlighted sort of obvious concerns, and this also informs the views that this also informs sort of the views that have to become more informed, are not always those of other are views that have been informed, and where those are views are not are not or sort of on the basis of the chronically those who might be, for example, chronically ill, those who might be disabled, those who might be carers, carers, or even relatives, but of unfortunately, for example, at the same time, for example, researchers, employers, and even sort of academics, for example, who can who can also lack awareness. So what the collaborators in this works also asked what asked the question, what could be done differently, or what should be done differently. And the main message in this works was that policymakers should be making more headway to support people with long-term conditions and disabilities, and to preclude discrimination and ignorance at all levels. So in around some overall sort of conclusions around this works as well. For example, social media usage has sort of increased exponentially, and the use of information and communication technology, and sort of highlighting the challenges of living with a disability or long-term condition through social media, has been has been or is important for most, because many of those who have long-term conditions or disabilities, for example, may want to be more involved to prompt issues like ignorance and discrimination, which can be overwhelming. all information and communication technology and sort of social media, those sort of social media interfaces are potentially helpful and should be prompted to preclude discrimination and or ignorance. However, acquisition or knowledge alone, unfortunately, is unlikely to be sufficient to motivate sort of attitude or behavior changes. Interplay also helps highlight ongoing sort of changes and where people feel pilloried. Awareness also needs to be from sort of bottom up approaches, where this would also constitute sort of what has been evidenced and referred to in the literature as patient and public involvement and PPI from sort of in around prospective aspects of around the initiatives and policy. So social media platforms, for example, like social media platforms generally are helpful. However, overall there should be a sort of a driven a sort of a sort of a driven sort of a change, and this needs to this should happen. This should take place or should take place since lives can be can be can be can be can be affected. And if policymakers are potentially discriminating at top down level, the then the collaborators in this work also highlight there thus needs to be a sort of a mentality change as well. So that draws this Bostix broadcast to a close. This is another a Bostix broadcast aligned to a news edition as part of a Bostix bulletin, a part of the Communique Tsunami, a chartered edition, and another evidence-based perspective. This is a newscast edition as part of another Storm Bostix production. And once again, there will be sort of a list of some citations in around this works, so that listeners or viewers can check out some of the resources that are on social media in sort of in around this works as well. Thanks for tuning in.